Around this time 6 years ago, I was hospitalized with a 104-degree fever at the UCLA Children's Hospital. I was 12 years old at the time, and the only familiar thing that I had with me was my mom. It took about a week to receive my diagnosis that I have systemic lupus erythematosus, or SLE. While this provided me with a justification for symptoms that I had been having, there was still so much for me to learn. Lupus is an autoimmune disorder defined by the Lupus Foundation of America as a chronic or long-term disease that can cause inflammation and pain in any part of your body. Autoimmune disorders occur when your good antibodies, the ones in charge of defending your immune system, attack healthy cells instead of foreign ones. In the next few minutes, I will share the common symptoms, treatment, and my experiences living with lupus. Statistically, lupus is more common in women of color, with diagnoses generally being made from ages 15 to 44. Being 12, I was somewhat of an overachiever, and while I had been having various symptoms throughout the year, such as canker sores, joint pain, and fatigue, it wasn't until I developed a rash on my cheek that I was first told about lupus. After receiving comments at school, I visited my dermatologist and had an ANA test done due to a suspicion of it being what's called a malar rash. An ANA, or anti-nuclear antibody test, analyzes blood drawn, with 98% of people with systemic lupus testing positive, according to the Johns Hopkins Lupus Center. While I tested positive, nothing was confirmed until I experienced my first lupus flare-up. Lupus involves the inflammation of one's organs, with common triggers being light exposure, emotional and/or physical stress, and infection. A flare-up can be mild or serious and generally involve more dramatic versions of typical symptoms. About a month after receiving the positive ANA test, I came down with what felt like an aggressive flu, where I had body aches that prevented me from moving and a persistent high fever. I stayed home and tried to fight it off for a couple of days before my mom and I went to the hospital. The complicated thing about lupus is that it is difficult to diagnose because everyone experiences it in a unique way. For me, my organ of choice is my skin, meaning if I'm on the verge of a flare-up, the first sign would be redness along with joint pain and achiness. I have found that the best way to describe this feeling is like the sensitivity of a sunburn on your entire body, where your skin is painful to the touch. I've also described it as having growing pains, but without actually growing, which I still don't think is fair. Along with it affecting every person differently, new symptoms can develop, or some symptoms may happen less often, as mentioned by the CDC. One medication that is used to treat lupus is the steroid prednisone, which causes various side effects such as chipmunk cheeks due to increased water retention, as well as weight gain and hair loss. I started out on 80 milligrams a day and have tapered throughout the years to where I currently am, because tapering or decreasing one's dosage is an extremely delicate process. Another medication lupus patients commonly take is hydroxychloroquine, which has received attention recently due to COVID-19. Because of people trying to stock up, it's been increasingly difficult for lupus patients to get the treatment that they need. For people that are already immunocompromised, this is harmful because not only are we more susceptible to catching contagious diseases, but we are also unable to treat our current ones. Lupus is chronic, meaning there is no cure, and the only way to deal with it is to adapt to a new normal. Getting used to taking daily medication, wearing sunscreen all the time, even at night, and having untreatable brain fog or memory problems are only a few of the changes I've had to accept. Luckily, I've been able to manage my symptoms with the help of my doctors, as well as discovering what treatments work best for me, such as using a service dog for medical alert. Being an invisible illness or a physical, mental, or neurological condition that is not visible from the outside yet can limit or challenge a person's movements, senses, or activities, as defined by the Invisible Disabilities Association, it is common for people to never hear or learn about lupus. While we do have symbols like the purple ribbon, as well as the wolf for the Latin root lupus and a butterfly because of the shape of a malar rash, the most effective form of education is by telling our stories. May is Lupus Awareness Month, and I hope that by telling my story, this has helped you learn a bit more about this complicated disease. Thank you for letting me tell my story.